So you're thinking of having pinhole surgery to fix your receding gums. Your dentist has explained the procedure to you and you've watched Dr. Chao's animated video of what's involved in the procedure. Now, the only thing holding you back is the long list of things you can't do for 6 weeks afterwards. You're worried that you won't remember everything you're not supposed to do. But don't worry, in this video I'll explain what you have to be mindful of so that you can get the best results from the procedure. So joking aside, even though the list of what not to do after pinhole surgery is long, it all comes down to one thing: not moving the lifted gums until they had time to heal and fix themselves in the new position. As you know, during the procedure, the gums are loosened and shifted up on the teeth to correct the recession. The only thing holding the gums in the new position are the little bits of collagen that are inserted under the gums. No sutures are used to hold the gums in place. So your dentist will tell you not to do certain things. Let's go down the list that Dr. Chao, the inventor of the pinhole surgical technique, recommends not to do. The first 3 things not to do are basically the same thing: no brushing, no flossing, and no touching of the surgical site. Until the gums heal in their new position, you don't want to touch them with anything. Not a toothbrush, not dental floss, not your fingers, not your tongue, not even a Q-tip. Don't even lick the surgical site. Touching the gum before it heals can move it back to its original position and will defeat the whole point of having the surgery performed. The biggest issue for most patients is not being able to brush their teeth where the procedure was performed. It's one of those things that seems counterintuitive and goes against everything you've ever heard about taking care of your teeth. But don't worry, after 6 weeks, you will be able to brush that area again, but you will need to use a special extra soft toothbrush, and you will have to be very mindful to use proper brushing and flossing technique to avoid causing gum recession in the future. If you need a refresher class on proper brushing and flossing technique, check out my How to Brush and How to Floss videos. I'll leave links to them down in the description. The next 2 items on the list are no sleeping with your hands under your cheek in the area of the surgery and no facial massages in the area of the surgery. Again, both of these are a form of the don't touch rule. Don't touch the surgical area in your mouth and don't touch the surgical area outside of your mouth. Putting pressure on the area, even from outside your mouth, can cause the gums to move and not heal properly. Remember, don't touch! The next few don'ts on the list might seem crazy at first, but they will make sense in a minute once I explain them. They are no looking, rinsing only with your mouth open, no wind instrument playing, no sucking on food or objects, no spitting, no blowing up balloons, no strenuous exercise, and no snorkeling. All these activities involve you moving or stretching your cheeks. If you have ever looked in your mouth, you may have noticed the way that your cheeks attach to your gums. The frenums, also called muscle attachments, anchor your cheek muscles to your jawbone through your gums. Since the pinhole procedure involves loosening the gums from the jawbone, now those muscle attachments aren't anchored until they healed. Any type of excessive cheek movement will move the gums from their intended position. So if you try to look at the surgical site, you might pull on your cheeks too much and cause the gums to move out of position. Rinsing with your mouth closed will cause you to puff out your cheeks, which can cause the gums to move out of position. Same thing with playing a woodwind instrument. Even if you don't puff out your cheeks when you play, the extra air pressure in your mouth can move the gums. Sucking on a lollipop, spitting, blowing up a balloon, strenuous exercise, and snorkeling can also cause you to puff your cheeks out. Snorkeling is the worst, since the snorkel has a rubber piece that fits into your mouth. The rubber can push on your gums and push them out of position. Finally, don't clench or grind your teeth. I'm sure you're aware that clenching and grinding your teeth can cause gum recession. If you are someone who clenches and grinds, Get a night guard made before you have the pinhole gum procedure. Lastly, avoid any type of smoking and avoid certain foods. Smoking will slow your rate of healing. Certain foods are more likely to get stuck in the surgical site, which could lead to an infection. Avoid foods with a lot of seeds, nuts, anything really crunchy, and avoid stringy meats. So to sum things up, remember, don't do anything that could move your gums out of position before they heal. For people watching who have had the pinhole gum procedure, how did it go afterwards? How difficult was it to follow the post-op instructions? Let me know in the comments. Thanks very much for watching, and see you in the next video.